Hi, everyone. Welcome. My name is Kayla Greenberg. I am the director of the Center for Latin American Studies here at the University of Pittsburgh, also a professor of the history department. And I would like to welcome everyone to the Policy and Advocacy panel, Current LatinX Affairs in Pennsylvania. This event is hosted by the Center for Latin American Studies as part of the University of Pittsburgh LatinX Connect, Elevating Latinx Identities and Contemporary Issues Conference, which is part of the Latinx and Hispanic Heritage Month celebration. I want to say that the center is very proud to be one of the conference sponsors and to participate in its organization, as one of the Center for Latin American Studies' mission is to promote global understanding through support for teaching, learning, and research of the diverse diasporic communities of Latin America and Caribbean origin. In this sense, we are very interested in understanding more about the current Latinx affairs in Pennsylvania, a state that houses more than 1 million people of Hispanic, Latinx, Latino, or Latin American origin. And myself, as a person that has just moved from Latin America, from Brazil, I'm especially curious and still dealing with a lot of identity issues that we're not addressing today. But I am very interested in learning and hearing from you. What does it mean to be a Hispanic or Latinx in this state? What are the current issues we're facing in Pennsylvania? How can we work as a community to elevate everyone, especially the people that are in most need? So this panel brings together people that work directly with the community and healthcare workers, whether from the university or as community or political leaders, to reflect on the diversity of our communities, aiming to spark further reflection of our future. In this sense, I am very honored to introduce our panelists and have our discussion started. So just to tell how we are organizing this, each of our panelists will address our questions for up to 10 minutes, and then we will open up the floor. Our first panelist is Kaylin Hidalgo-Schick. She is in the Latinx Constituency Director for the Pennsylvania Democratic Party and also an alumna of the center. So Kaylin, welcome.
Thank you, Kayla. Hi, everyone. So like Kayla said, my name is Kaylin Hidalgo-Schick. I am the Latino Constituency Director for the Pennsylvania Democratic Party. It's actually the first role of its kind, which is pretty cool. Usually it's a temporary role, but the party's making big investments, and now we have it year-round, not just during a big election. So I'm also a alumna of the center, so thank you so much to class for everything that you've done and for organizing this as well. So in my past, I worked in youth and immigrant serving nonprofits, where I was first introduced to organizing and really the power behind community. And then I went on to GISPIA, which is the Graduate School of Public International Affairs at Pitt, and class, where I really found this a disconnect between policies and who they're meant to serve. So like I said, my current role is the first of its kind. And, because the party is making these investments, it's important to have a behind the scenes person, not just an elected official or someone who's more knocking doors of Latino origin. Now it's someone behind the scenes advocating for the Latino community. Some things I'm working on is getting on the ground and speaking to community leaders, volunteers, and really trying to help bridge the gap between the party at all leaders, whether it's state, county, city, town, even more neighborhood groups, grassroots groups, and the Latino communities in these areas. I'm building programs with more cultural competency and community participation. Something important to note is that the Latino community is not a monolith throughout the state, throughout the country, and each neighborhood is different. There's huge cultural differences between, as I know a lot of the panelists will also agree with, between Mexicans and Puerto Ricans and, Dominicans and Cubans. but also between established communities. So out in Philly, there's a more established community already, and emerging communities like out here in Western Pennsylvania. Different needs to address, different issues that bring people out to the polls and that need a lot of advocacy behind them. A lot of the past policies have ignored that fact, and it's crucial that lawmakers and leaders just don't simply believe that Latino issues are immigration issues, right? That's a common thread that we've heard before. COVID, for example, obviously disproportionately impacted communities of color, especially women and Latino women who work in healthcare sectors, caregiving sectors, and the service sectors. And it's affected our children as well, right? Latino children have been disproportionately affected by COVID and how learning happens in schools as well and at home. Something else to note that I really want to emphasize is that redistricting is coming up. And we have a huge election coming. Well, we have all elections are huge elections, but we have a huge election coming up in 20 days now, with over 20 Latino candidates running around the state, which is quite remarkable, all the way down from school board to city council to county council. But it's still not representative of our demographics. And it's really important to get out and vote every election, not just in the presidential elections. The census showed an increase of, I think it was 45%, over 45% of Hispanics in the state, and the non-Hispanic white population decreased, right? So it's showing how much more our votes and our voices really carry and should be represented. I think the main point that I really want to get across throughout this panel is that participation, whether it's voting, running for office, volunteering, being a leader in your community, leading a protest, going to a protest, or going to advocate or testify on behalf of your community. And like all these incredible leaders that we have on this panel, that's how we do better for our communities. So thank you again so much to class and to Pitt and LatinX Connect. Yeah, great to be here.
Thanks so much, Kaylin. And it's so good that you mentioned the elections coming up, because this is, for sure, this is a big moment. And from what you say, and from what I have been hearing also in several public political activities, it's supposed to be a very new moment for the Latinx community in the state. So I'm curious to see the results of that election. So I'm gonna pass the word to Luz Colon, who is the Executive Director of the Governor's Advisory Commission for Latino Affairs. Thanks, Luz, for joining us. The stage is yours.
Well, thank you for having me. This is really quite an honor to be here with these wonderful panelists, and just really to discuss the overall view of what we're looking at here in Pennsylvania as it relates to the ongoing growing Latino population here. So just a little bit about me for those that, for the viewers that are watching and that don't really know who I am. My name is Luz Colon. I'm the Executive Director to the Governor's Advisory Commission on Latino Affairs. And I was appointed back in 2016. And I have in total have been serving our local government and now our state altogether for the past 25 years. So I started at a very young age. And again, civic engagement for me has been a very key component and a learning curve throughout my leadership. So I really do take that to heart. People ask, they ask me, okay, so, how did you really get involved? How, did you start at a very young age? And basically, I think it has a lot to do with my upbringing. Living in an urban area, North Philadelphia, growing up, you want to be able to kind of just be a part of the community and make a change in some way. And by doing that is joining forces with other local leaders, really volunteering your time in voter registration, voter outreach, education, and just gathering our community leaders and just, moving the needle forward. So, those obviously were, very beginning stages for me. But now I'm in this role. I'm in this role as the executive director to this commission. And I am extremely proud of a lot of the work that we are doing. and continuing to do moving forward. So I'm sorry for the background. So what I want to mention is just share a little bit about our mission statement. We're leading agency of 30 members, and we have representation all across the Commonwealth, representing the larger populated areas of Latinos. And what our commissioners are here to do is serve as an ambassadors and the voice for our community and bridge the gap to local government to share recommendations or address any concerns that may be happening in the Latino community all across the Commonwealth, so we can bring it to the forefront and address those issues head on. We can go off a number of topics that we are dealing with now. Under our commission standpoint, we have about 5 committees. We have education, health committee, civic engagement, workforce development, and government that works. And each committee have been working with policy and recommendations to be able to help better serve a Latino population. And we're really proud of the work. I mean, I think that the partnership goes beyond anything I could ever imagine. Every agency within the that we have been working with has been such strong supporters on what we want to do on a statewide level as it relates to the Latino population. The other thing I wanted to address, obviously, we're in a time of the pandemic. Obviously, look at us, we're in the virtual world, but at the same token, the pandemic and dealing with the hesitancy for COVID-related issues have been one of our top priority topics. We have altogether done about, I would say, 36 virtual events reaching out to our Latino population. And some of them have been in Spanish, some of them have been an array of different medical professionals. But at the same token, we also have implemented individuals that are experts in immigration reform, immigration issues. And the reason for that is because what we saw within our Latino community is that a lot of folks were hesitant to fill out a form to get vaccinated because they were in fear of that information sharing to other entities. So we wanted to bring in the experts to be able to talk specifically about those issues because, again, one of our goals is to help ensure the safety and the health and wellness of our Latino population here in the Commonwealth. And the way to do that was to be able to engage our community partners and engage our medical professionals to talk about these specific topics. So, again, and also in the spirit of Hispanic Heritage Month, we know that tomorrow is our last day for celebrating Hispanic Heritage Month. But again, we have embraced honoring local leaders and highlighting our culture and just taking the time to celebrate and embracing our heritage, but in the same token, also discussing the importance of being healthy. So we have been putting that in our best practices. I have visited a number of different areas in the state to be able to share the proclamation, but also encourage people to get vaccinated. So, which been, and now it's still an ongoing effort for us. So we're really happy about the work. We're really proud of what we're doing here in state government. And we're looking to continue partnering with other folks to be able to elevate and enhance our leaders in the community and to make sure that they're resourced. I think that's one of the issues that we have come across, where we want to make sure that our organizations are provided with certain information as it relates to emergency resources, particularly with the ERAP program. I'm not too sure if you all are familiar with this program, but again, with the amount of resources that we have, there shouldn't be, we should not see someone either living out of their car or anything like that. We should make sure that we're doing everything possible that to resource individuals so that they can continue to either stay in their homes, stay in their rental properties. So that's one of our partnership with DHS to make sure that we're sharing that information in Spanish. And just recently, we had a Spanish press conference, which I was thrilled. I think that for me in state government, that is a breakthrough. That is something that we haven't seen in the past, where here our commission has been advocating to do more press conferences all in Spanish. And that's the goal. Again, we want to make sure that our priorities are in top layer, and also discussing with the amount of Latinos, as Kaylin had expressed earlier, of the census numbers. Language access is going to be a really big piece for us moving forward. There is some there's some, groups and work groups that is working through this, but again, it's going to take a collective effort so that everyone understand that language access is going to be a really key element as it relates to everything in state government, and particularly with voter registration and education. DOS is also working with a language access piece to be more inclusive in the voting places. So that's a really big partnership we're really proud of too. But again, I'm happy to be here. It's again an ongoing effort. Again, for me, this is 25 years of service, and we want to make sure that the time that we do have here is that we're making strides to live a better tomorrow for all Latinos in Pennsylvania.
Thanks so much, Luz. I am, the topic of language access, which we can discuss later, is a very, very big one, as I think that in different instances, all of us, we face either being born here or being immigrant. This is something that as we relate to each other and as we face or try to build a community, the ability to communicate and to have a common language is always a big topic. And I imagine how big it can be, especially in this vaccination efforts that you were doing, which I find spectacular and really, really necessary. So thank you. And with that, we are going to pass to our third presenter, which would be Mayor Eddie Moran, who had a family emergency and unfortunately won't be able to be with us today. But representing him, we have Abraham Amoros, who is here with us. He is the first Latino member to be appointed to the Penn State Board of Trustees in 2018, and then reappointed for another 3-year term, and is also the managing director for the City of Reading since last November. So, Abe, welcome.
Thank you very much. I greatly appreciate everyone's indulgence. And again, Mayor Moran sends his warmest regrets. He had an unexpected death in the family as a result of COVID, but I wanted to let you know how sorry he feels that he was unable to share his thoughts with you today. Again, my name is Abe Amoros. I'm the managing director for the City of Reading, and I also want to thank you for being so welcoming to this Penn Stater. I want you to know that the University of Pittsburgh is one of the most beautiful campuses I've ever visited. In fact, I've spent many good nights at the O at all hours. I won't get into specifics, but just know that I'm a big fan of the University of Pittsburgh as well. I got my start right out of college at Penn. After I graduated from Penn State, I ran for office. I also was an elected official. I ran for York City Council in 1991. I can't believe it's going to be 30 years. Oh my goodness, the O closed. Thank you for letting me know. That's so sad. However, I wanted you to know that I got my first taste of politics when I was in college. And as a result, I wanted to do something for my community when I graduated. So I ran for public office in 1991. I became the first Latino elected to the York City Council, also the youngest member as well. And from there, I developed an affinity for local and state government, having worked for a state senator. And then I became the spokesman for the Democratic leader of the state Senate before going back to the city of York to become the community development director, where I had an $8.3 million budget in housing, planning, zoning, and health, and also launched my dream of bringing a formalized Little League baseball program to the city, which is still in play. In fact, it's been 16 years. Very happy that I was able to get that off the ground, and I had a little bit of help. And you may know the gentleman I'm talking about. Governor Tom Wolf at the time was the Secretary of Revenue. He's also from York, and he helped me with raising $1 million for 3 lighted Little League baseball fields that I will always be eternally grateful for, simply because that program is still intact. I went back to state government and I became the Senior Deputy Press Secretary to Governor Ed Rendell. I did that for some time. And then I walked across the street and became the Director of Communications for the Pennsylvania Democratic Party. I can't tell you how happy I am that Kaylin is in that position. It's been a long time coming, and I wish her nothing but the best. She and I and the mayor had an opportunity to sit down and talk several months ago, and she was kind enough to share this invitation with us. So I'm greatly indebted to her as well. And it was good to see her at the Pennsylvania Latino Convention and also the GACLA event. And of course, Luz Colon is also a wonderful, passionate advocate on behalf of the million-strong Latinos in Pennsylvania. So I applaud her work as well. From there, I became a lobbyist for a labor union, the Labor's International Union. I did it for 9 years. And then I decided to hang my own shingle, and I taught some classes at the graduate level and undergraduate level at York College of Pennsylvania. And then when this opportunity came about 11 months ago, it was just too good to pass up. And as a result, I'm here. I also hold a master's in governmental administration from the University of Pennsylvania, along with a journalism degree from Penn State. Penn State is a labor of love in terms of the time and effort that we put into making sure that the university community is well represented. Speaking of well represented, my passion is to ensure that every Latino has access to quality services, not just at the city level, but in terms of education, in terms of entrepreneurship, in terms of healthcare. We have a lot going for us right now as Latinos, and we have that momentum, and we've got everyone's attention in terms of elected officials, appointed officials, and I'm going to recommend that everyone not only register to vote, but become active in your local party. The local party is where the action takes place. It's where the rubber meets the road. The local parties are what fuel the state party. And the state party's done a very good job in terms of doing outreach, as evidenced by Kaylin's presence today. And it's going to continue, especially in the upcoming elections. So I'm going to plug those elections very hard. Every election is important. Yes, we have an election coming up on November the 2nd, and we have a big election coming up in 2022, where the governor's race and the United States Senate race is going to be up for grabs. And it's important that we talk to our neighbors. It's important that we talk to the folks we go to church with, the ones we go to the supermarket with, on the importance of getting involved locally. It's where the rubber meets the road, like I said. And we have a responsibility to educate our fellow Latinos on the importance of getting involved in the civic process. We have a responsibility to encourage them to run for public office, to be part of the process, and really get to know where the money comes from, how things are funded, how things work at the fundamental level. Here in the city of Reading, we have been blessed with American Rescue Plan dollars that are going to have generational impacts here in the city in terms of infrastructure, our streets, our sidewalks, our playgrounds, our parks. Those take people to make those decisions. Now, we are the 4th largest municipality in Pennsylvania, 95,112 strong, and we are now a second-class 2A city, which brings along other perks that are useful in terms of resources. So my message to you is get involved at the local level. My message to you is to include others in the process, encourage them, make sure that they understand the power that they have. And I used to get this all the time. What is the definition of a stakeholder? How can we become stakeholders? And I learned in graduate school that the definition of a stakeholder is anyone who thinks he or she is. Let me say that again. The definition of a stakeholder is anyone who thinks he or she is. It starts with you as an individual, wanting to get involved, having the confidence and developing that skill set to run for public office, to become an appointed official and be part of something that's big. We have a responsibility, and I say that word a lot, because we who have leadership positions have to bring others along. We can't be the only ones in the room advocating. So thank you for listening. I appreciate your time. I look forward to any questions.
Thank you very much, Abe. This is really interesting and important, and I'm also already writing down a couple of questions that I have, especially now. I think that this is fortunate. We probably didn't plan this, but the fact that we are only almost 2 weeks from the election makes the whole discussion even more important and more urgent, I think. But before we go, we pass to the discussion. Is Monica here? I want to pass.
I am here. Thank you.
Oh, okay. Thanks. I'll pass the stage to Monica Ruiz Caraballo, which is the executive director at Casa San Jose. Monica, welcome, and it's your turn now.
Thank you. Thanks for having me. I'm also, I often neglect to mention also that I am a commissioner for the governor for the Latino affairs.
Sorry about that.
No, I never say it. I never say it. And then I see like other people using it in their title. I'm like, why don't I say it? But anyway, so really, really grateful to be in that, serving the governor in that capacity. I have been very fortunate to serve in that. I mean, it's a big responsibility. You know, a lot of work goes into the things that we do, making sure, you know, one of my biggest goals have been to make sure that, you know, we are bringing representation to this side of the state so that folks know there are Latinos here. We're doing a lot of great things. And Luz has been always very, very helpful and grateful and always offering platforms to make those connections possible. So thank you. I just wanted to talk a little bit about, you know, we have a whole department of civic and social engagement. Sister Janice Vanderneck, our founding director, is the person that works heavily in that department. And that's something that's been in our vision and our mission since the inception of Casa San Jose. One of the things that we believe is that, you know, if you know, a lot of the things that are happening today are happening because decisions were made about people that look like me and you by people that don't look like me and you. And so when we want to start to change that, we have to have a seat at the table. And so running for office is a really great way of doing that. Another great way is holding our elected officials accountable. And so, you know, I tell people all the time, please call your elected officials to tell them when they're doing something you don't like. Also call them to tell them when they're doing something that you do agree with. And if you don't feel comfortable talking to them, then call it 501 and leave them a voicemail. Okay, but you have to do something. The time to sit back and say, oh, you know, I'll get involved next time or with the next election, or I'll only vote for the president. That time has long and gone. We are way too smart now. We have to really start to get engaged. The vast majority that we serve, of folks that we serve proudly at Casa, don't have the ability to vote, but guess what they do? They have the ability to speak to people that can vote. So helping people cultivate and share their stories so that because they work for people that can vote, they're neighbors with people that can vote. So making sure that they're getting their voices and their stories out so that when people are making decisions of who they're voting for, they're really taking into consideration the needs of the people that live near them. The other thing is that, you know, it is about getting people involved to vote. And so, you know, Casa doesn't only do work here in Allegheny County, but we actually are working in 5 different counties. And recently we had a nice amount of folks arriving from Puerto Rico. And so those folks are able to vote. So we worked alongside the commissioner in that area to make sure that we got people registered to vote, took them to the polls, kept them engaged, and making sure that they're getting the services that they need once they're voting, which is a whole nother project that we're working on with the commission as well. Yeah, again, you know, Casa is always committed to having the voices of the community lead. and making sure that their voices are the one that's heard. Even if they cannot vote, that doesn't matter. There are other ways to get that done, get those things done. And guess what? They're having children that eventually will be able to vote, and they're going to be able to carry that voice. So I'll leave it there and really look forward to hearing from everyone else and taking questions later.
Thank you very, very much, Monica. It's very interesting to think about the relationship between the voting and the non-voting community, which, and how this generation gap can play an important role. So more soon for the discussion. So now our last presenter, Diego Chavez Nieco. He is the developmental behavioral pediatrician, associate professor at the University of Pittsburgh School of Medicine, and also the director and founder of the Salud para Niños program at UPMC Children's Hospital of Pittsburgh. So thank you very much for joining us, Diego.
Thank you, Kayla. Well, I want to start by thanking who put together this panel, Gina Garcia, Kayla Greenberg, class, the University of Pittsburgh, and all my fellows panelists. I'm honored to be part of this panel. Of course, as a pediatrician, you will understand that my hat comes here probably health first, and of course, health has to do with policy and with voting. I have a short presentation that I want to share with you guys, and actually, it touches with some of the things that we have been talking. One of the things that I do is my focus of work is addressing barriers to healthcare access. If we don't address barriers to healthcare access, we are not addressing healthcare disparities. Disparities happen because people have barriers to healthcare access. And we have talked about language access, and that's the first one that I have right there. There are many others, such as cultural, insurance. For that, we have, for example, a clinic for people who have insurance versus a clinic that is free. Socioeconomic status, transportation, we have a mobile unit. I'm going to show you some pictures. And of course, immigration status, which has a big role in terms of politics. Now, I like to share this slide. This is from the Census of 2020 for many reasons. One is because of the things that have been talked already. The Latino population is growing. It's growing in Pennsylvania. It's growing in southwestern Pennsylvania. We're now 8% of the total population in Pennsylvania. And for the students who are listening to this presentation, I like to this slide as well because it makes the case that race and ethnicity are not the same. So you can be Latino, you can be white, you can be Latino and African American, you can be Latino and American Indian. The other point that I wanted to make with this slide is that, again, if you look at the number, we are 8% of the population in Pennsylvania. That's the same number of hearing impaired people in Pennsylvania. It's 8%. When you see the press releases done by my colleague and friend, Dr. Deborah Bogan, director of the Allegheny County Health Department, when you saw last year the press releases made by Dr. Levine from the Department of Health from the state of Pennsylvania, or the current dignitaries from the Department of Health in Pennsylvania, you see that those press releases come simultaneously with sign language, but you don't see that they come in Spanish, that they come in Portuguese. And we are the same number in terms of percentage in the state of Pennsylvania. So we should be having all those press releases in Spanish, in Portuguese, either with simultaneous interpretation or with closed captioning. One of the reasons that we have these huge disparities in the pandemic is because people didn't know about the pandemic. People were not able to hear the message in their own language. So we need to address those barriers. Here are some cases in Pennsylvania, and unfortunately, part of the problem is that we're still invisible. We're invisible when people come to Pittsburgh and say there are no Latinos in Pittsburgh, but we're invisible when the state is counting the number of cases in Pennsylvania, and the majority of cases are cases that we don't know if they were Hispanics or non-Hispanics. We know for sure we have an overrepresentation of cases of COVID-19 on the state of Pennsylvania, and of course in our region in Allegheny County, western Pennsylvania. We have also an increase on mortality, and again, we go to the same problem. There is a large of no reporting, no case of ethnicity. The good news is that we're doing a good job in vaccination, and Luz Coulon mentioned some of the things that they're doing at the state level. And here at the local level, with Monica, with Casa San Jose, we have made a big effort. And we are doing a better job than the general population, but the job is not complete. Luz mentioned this, we're still working on this. We want to have 70, 80, 100% of the population vaccinated. The FDA just announced today that the Moderna boosters are being approved, and we're expecting in the next couple of days, couple of weeks, to have kids between 5 and 11 being vaccinated against COVID. We need to continue vaccinating. We need to make a big effort that everybody is protected. I'm going to talk a little bit about my program. So I came to Pittsburgh 22 years ago. In 2002, our program, Salud para Niños, is celebrating 20 years of the creator. creation. Salud para Niños are the two words in Spanish for health for the children. And actually, Salud is an acronym that stands for Students, Residents, and Faculty United Against Health Disparities. That's one of our goals, to reduce health disparities. And we do that by addressing barriers to healthcare access. And we're going to be addressing healthcare access by changes in policy. We have many people who are involved in the legislation here. And actually, everybody who's listening to this presentation has the potential to vote and to advocate for the community. There are 24,000 Latino children in the state of Pennsylvania that they will never get access to health insurance because of the way that the legislation is right now. There are many organizations, including an organization that is called Children's First, who is advocating for changes on the legislation so Pennsylvania can have truly universal health care for all children in the state. Those 24,000 children right now that will never have access to health insurance. We are behind many other states, Massachusetts, Illinois, California, New York. They have universal health care. Children can have healthcare access. I put a lot of emphasis on prevention and healthcare access. If people have healthcare access, if people have health insurance, many of the chronic conditions such as obesity, hypertension, diabetes would have been under control. And if those conditions would have been under control, we wouldn't have the morbidity and the mortality of COVID-19 in our population. One of the reasons that our population was highly affected is because we as Latinos are the largest group in the state and in the nation to have uninsured members in our community. So we need to make sure that everybody has health insurance. We need to start with those 24,000 children I mentioned before, and ideally with everybody. The money that we put in making sure that everybody has health insurance and in prevention is going to be safe in the long term with avoiding hospitalizations, with avoiding ICU admissions, with avoiding mortalities, like in this case from the pandemic. Another goal from our program is to combat social isolation, to partner with community agencies such as Casa San Jose, to permit systematic data collection, and to create an ideal environment for developmental screening. The clinic, as I mentioned before, was created 20 years ago. In 2022, we'll be celebrating 20 years of the creation. It's a medical home. We like to think of ourselves not only as doctors who are in the exam room, but who are in the community. We're working with the community and in the community. We partner with different organizations. We provide services at different locations, at Children's Hospital, at the Birmingham Clinic, in Casa San Jose, and through our mobile unit. And at the end, our goal is to increase prevention and empower the community to address its own health. So we have now clinics in Oakland on different days, staffed by Spanish physicians, nurses, and volunteers. We have a Spanish line. We were the first local Spanish line. And actually, we're also reaching out to the Portuguese-speaking population as we have a Siracom interpreter system to provide for these families. This is our mobile unit, and we take it every Tuesday morning to Casa San Jose, and everything that we do in the mobile unit is free care. It's for people who don't have health insurance. And the same unit, we bring it to the Salvation Army, to the Birmingham Clinic, the second Saturday of the month. We now have several specialties, and I'm glad to announce that in 2021, we launched 2 subspecialty clinics, pediatric subspecialty clinics. Now we have pediatric cardiology and we have pediatric ophthalmology. And despite the pandemic, 2020 was the year that we have seen the most patients, with the most visits for uninsured patients that we have provided. And 2021, we're on record to break that number. We are outside in the community, as I mentioned before. We promote healthy habits on ongoing programs in different community events and organizations. We do a lot of advocacy. In prevention, and in particular, injury prevention is high on our radar. We created this Hispanic Latino crisis checks in our community. We have done 26 events since 2003. 622 crisis checks have been done, and 309 crises have been replaced at no cost to the families. We also put a lot of work in terms of physical activity, obesity prevention. A few years ago, we partnered with the University of Pittsburgh soccer team, and the idea was to tell the families that in order to be physically active, they just needed a ball, a park, and play. You don't need to belong to a fancy league. I like to highlight in this slide that mom is playing with heels, so it's just a matter of being active. That's how we're going to be putting prevention, how we're going to protect our community. We also have a early literacy program where we want to promote early literacy in our children. We want them to be successful in school, but also this is a way to incentivize English as a second language for the parents of our children. So starting at 6 months, we give them books to the kids whenever they come to a clinic. And we have partnered with a local initiative, the Pittsburgh Promex, that was with the Pittsburgh Public Schools. The idea is that if kids graduated from high school and they have a minimum of GPA of 2.5 and they have a minimum attendance, they can get money to go to any university in the state of Pennsylvania, public or private. They can go to Penn State in honor to Abby. So we have been successful because many of our kids actually that I started seeing 20 years ago, now they are in college. They are first generation graduating from high school, first generation going to college. And the way that I measure the success of the program is if these kids grow up and they do good and give back to the community. We partner again with other organizations like the Latino Family Center. We propose the creation of this to the county. And then as a final conclusion, we need for cultural and linguistic competent healthcare for Latino children, but as a matter of fact, for all Latinos, for all children in Pennsylvania. We do need to have universal healthcare for children in Pennsylvania. We need to put emphasis on prevention and promotion. All the money that is put in prevention and promotion will save us dollars in the long term. A lot of the times we don't need new resources. The resources are in place. They just need to be connected. And we need to advocate for those who cannot speak for themselves. In my case, as a pediatrician for children, they don't vote, they don't speak for themselves. We need to advocate for them. And in the case for everybody who's listening to this presentation, we need to be the voice for Latinos, because in many times Latinos cannot speak for themselves. So I'm going to stop there, and I'm going to thank you for this opportunity again. And I'm going to thank the team and the panelists.
Thank you very, very much, Diego. I think we have several topics to discuss. We have 90 people watching us, and I'm sure that there are lots of questions and thoughts that if you are in the audience and wants to share with us, please feel free to do so on the Q&A. But I wanted to, just from your presentation, Diego, I wanted to address one question that is, that often I have myself. Of course, all Brazilians have an issue of defining themselves as Latinos. And given that this is an American concept in the first place, this is not something that we deal with there in Latin America, but also the fact that it doesn't fit. And you were the first person that actually mentioned Portuguese more and one of the needs. But what I ask myself is, when you have to tick the box, is that discussion about identity, origin, and ethnicity. And I noticed that in the census, and this is a question for all of us, some other race, I don't know if you can go back to that, but some other race, when you are among the Latino population, is really, really high. And when you compare to the overall census, this is not something that appears as a common definition. So I was just wondering, what does it mean? What does it mean for the Latino population to say in many cases that they are for some other race that is not white, that is not African American? So this is just a general question that relates to the whole issue of identity, but also relates to the visibility and the invisibility of the Latinx population in the state, I think. So this is something that I'm very interested to hear more from you. And also, among the whole discussion about the population in the state, one of the things that we commonly hear is that there are not that many Latinos in Pittsburgh or in that part of the state, whereas they are really located in the east and around Philadelphia. So how do you see this gap? How do you see this distribution? And what can be done in the sense of just either bridging the gap or in the sense of policymaking, how that affects it? So that's my second question for everyone. And my third question for everyone, especially that we have elections coming up, is that if you could reflect a little bit on the Latino voting behavior, which was something that was very discussed in the past presidential elections. And it's still, I think it's still under discussion. From what everyone has said, we are all in sort of the one side of the elections and hoping to get more engagement and more people voting. But how do you analyze the way that the Latino population vote? So I will leave these 3 questions for who wants to jump in and discuss. And then I'm gonna pass to the Q&A and read some of our audience questions.
I'm going to try to take a shot to the first 2 questions in particular. So you know, when people answer the census, we tell them that there is not a wrong answer. Anybody can answer any way that they want to. And you're correctly, this is a construct that it was created here in the United States. I remember when I first moved, the census of 2000 was happening, and I was a little bit troubled by the fact that I needed to answer whether I was Latino or not, because until then I have identified myself as Colombian. When you are in Colombia and you have lived your entire life in Colombia, and when you're in Brazil and you have lived your entire life in Brazil, and they ask you, what are you? The first thing that you're going to say is, I'm Colombian, I'm Mexican, I'm Brazilian, I'm Puerto Rican. You're not going to say I'm Latino. So this is a construct that happened here in this country. Now, despite the fact that I had that internal emotional discussion with myself back in 2000, I realized how important this was, because that was the way to show that we existed. That was the way to show that we needed services. And you're right, here in Southwestern Pennsylvania, we're an invisible community. We're an invisible community because we have small proportions. We're not even the 8% at the state level. We're probably close in the best case scenario to 3% in Allegheny County, but we're 50,000 Latinos in Southwestern Pennsylvania. Think about that, 50,000 Latinos. That's a very important number. And then again, we have some commonalities with the rest of the Latino population in the state. While we're invisible here, I will say we as Latinos in the state of Pennsylvania, we're still invisible. Because again, I make the point, when you hear those press releases from the health department in the middle of a pandemic, and you see that there is simultaneous interpretation for sign language, but there is nothing on Spanish, nothing in Portuguese, bottom line, we're invisible. So it's really important that we make ourselves count in any way that it is, either by speaking for ourselves, by speaking for other ones who cannot speak, by voting. And with that, I'm going to turn to others in the panel.
So who wants to go next?
I want to touch on a little bit about your first question as it relates to the census. I remember when we were really discussing exactly like advocating what exactly needed to be on the census form. One of the pieces that we were really focusing on is making sure that there wasn't a citizen question checkbox on the forms, only because we knew that that would be a detriment to some of the feedback that we wanted to get for the census. So we know we want to be able to perhaps in the future look at in which ways we identify ourselves, but at the same token, I think what was very precedent at the time was making sure that that question was not on the census forms, because we wanted to make sure that everyone was counted. And we needed to do everything possible so people would feel comfortable in filling out the form. So that's one of the topics that I really wanted to touch on, because again, it's really important, again, that we did get the numbers that we received. And needless to say, I mean, to our surprise, look at where we are. We're the first in the nation of the most Latinos here in the Commonwealth. So again, I think, you know, looking at where our Latinos are migrating at, but at the same token, we understand that they're also moving into more of the rural areas in Pennsylvania. And what's happening is that we need to make sure that we're holding ourselves accountable to reach out of those local leaders in those areas that perhaps may not have those information and resources that are written in Spanish, that we go to these different regions, that we do partner with the county commissioners and discuss the matters and do an assessment. We did that with Lawrence County. We're really proud of that work, where because of the commission coming in and appointing a commissioner within the region, now there was a face, a representation of someone that represent their you know, them and the Latinos in the area, where before they didn't have that. And we wanted to make sure that we're doing our part in identifying other areas in the state that there is Latino representation, and have a commissioner or partner with a Latino organization or partner with a Latino that wants to be able to make a difference in the area and help them and give them the tools that they need so that we can be able to continue to bridge the gap. We do see that, and we want to make sure that if there is any issues as it relates to inadequate, in folks that are not doing what they need to do in order to help them get information that they need, we want to make sure to identify those issues, bring them to the forefront, and meet with those individuals to make sure that they are servicing our Latino population. It's very critical because, as I was mentioning before, there's so much information and there's so much resources that we can share. And what we have seen in the past is that they're not really passing it through to the stakeholders that need it most. And what we want to continue to do is identify the issues. Perhaps there is a barrier that they maybe feel like, okay, so how do I even reach out to them? I mean, so we want to be able to come in to help bridge the gap, to hold those individuals accountable, to make sure that they're sharing the resources necessary. And if it's not in Spanish, then we'll make sure to get that information translated into Spanish so that we can be able to have our Latinos understand the information. So again, and that's part of the work that we do on a statewide level, where, the census numbers, the information is there. And we're really going to use that information to our advantage because, before, as it relates to, like, say, for instance, language translating individuals to help in the polling places, where the argument was before, well, the county commissioners will say, well, we don't have the numbers, so therefore we don't have the resources to provide those services. Well, now that has changed. And we're really happy about that because now we can hold them accountable to make sure that if somebody's going to the polling places, that they have someone that looks like them, speaks like them, and they're comfortable in casting their vote without any issues moving forward. So we're really happy to work with the Department of State with some surveying that we're doing as it relates to voter education. So, again, this is an ongoing effort, but again, it's going to take a collective effort for all of us to make sure that we're continuing to identify these issues and also continue to make assessments in different counties and holding the leadership there accountable so that they could be able to provide the resources that they need. So, and again, we're always happy to partner and continue to grow as a commission.
Thank you, Luz. Does someone want to jump into this? Some of those questions? So if not, I'm gonna, we have some questions here in the Q&A, and I'm gonna, actually, there is one specific for Abe, saying that you mentioned that Latinos should encourage fellow Latinos to get involved in the elections and to run for public office. What can non-Latino allies do to best support, encourage, and stand up for Latinos in today's community and society?
This is an excellent question, Hunter, and I thank you for posing it. Latinos need allies. We're still greatly outnumbered in terms of the population. And now that the Latino community is getting more support from non-Latinos in terms of running for office, in terms of being part of the community as they relate to nonprofit organizations, community groups, we need that help. And I'll give you an example. Last night, I participated in a lead abatement presentation in a surrounding municipality. We were talking about how African-American and Latino children are 2 and 3.5 times more likely to become ill due to the effects of lead paint, which is in our older housing stock prior to 1978. I was the only brown person in there. And I say that simply because we need to have those allies who advocate for our issues and for us as well. Let them serve as conduits and connectors to elected officials, to appointed officials, to business leaders, to create opportunities. Get to know Latinos as individuals in your school, in your neighborhood, in your church. If you run into them at the supermarket, find ways to connect with the Latino community at the basic fundamental human level. Introduce our people to your people, basically. Allies are so important in our society. And it reminds me of that wonderful story that I used to allude to in my political advocacy class in my graduate course. When students sat at the foot of the teacher in ancient Greece and said, "When is justice coming to Athens?" the teacher said, "Justice will only come to Athens when those who are not discriminated against are just as indignant as those who are." That's the power of allies, folks. And Hunter, thank you for that wonderful question.
And thank for your answer, which is it's very encouraging. I think that for all of us to get more involved, and also to think about even like non-citizens like me, of the ways in which we can actually participate and engage with the upcoming elections that will affect us all. Actually, that's what we say outside of the U.S., and especially in Latin America, that everyone should vote in any American election because it affects us so directly, everyone in the world, that we would be good if we could all vote. Anyway, I'm going to read Manuel's, our associate director, Manuel Romano Lacayo's question. He asks that, considering the participants and their collective experience, I wonder if they have noticed change in the way Latinx are approached or politically engaged over the last few decades, and how their concerns are expressed or made evident. If so, what underlies those changes? And this is such a good question, Manuel, because I think that also they have been approached or politically engaged probably in a different ways over time. I'm eager to hear the answers, but that makes me go back to that question I was thinking, is that how people vote. So, who wants to go on that?
Well, I will say that things have changed tremendously in the last 20 years. It has been in Pittsburgh. Going from being an invisible population to being a population that is counted by others. We're still being invisible, and I will keep repeating this in Allegheny County and in Pennsylvania until I see, for example, those press releases that I was talking before in Spanish. I will say that we're invisible. But I'm going to end my statement with what happened 2 or 3 nights ago. For the first time in Pittsburgh, there was a mayoral debate that it was led by a Latino organization, Casa San Jose. Monica is smiling. Monica can tell us more about this one. That's huge. That's huge. Prior to this year, in mayoral elections, in any elections, Latinos were completely invisible. Now we're having a voice. I was so happy to hear in the news that there was a mayoral debate hosted by Casa San Jose.
Monica, do you want to follow up on that?
Sure, absolutely. Thank you, Dr. Diego. I think that, people that are running for office are making a huge mistake, not including the needs of the Latino community, and not knowing, we are not all the same. We are not, some of us are born here, some of us are not born here, some of us are extremely conservative, some of us are not, some of us are first generation, second generation. And unless you, again, it's people, I said this earlier today, but people say, "Oh yeah, we want to connect with the Latino community. We want to know," and they want to just scratch the surface. And there's so much more. You have to really start to dig deep to understand the issues, how they affect us differently. And an issue can affect me very, very different from someone who's recently arrived from their home country, and to somebody who's been, here, 10 generations deep. So, if you really want to be an ally or know more about the community, I really invite you to do some work with us, stand alongside us, see what's happening in this community. Don't listen to the person that speaks the loudest and says the most, many times untruthful things. Like, really get to know what the needs are, and then share the stories. We have so many volunteers at Casa. We have over 100 active volunteers per month. And they're our American neighbors, our white American neighbors, and they're learning and they're sharing those experiences with others. And that's what's going to help change people's hearts and people's minds.
Yeah, Monica, just what you said, like to echo that, but also not only just electeds and, people in leadership positions, but from an organizing standpoint and, how we're strategizing, reaching out to Latino communities, to all communities of color and underserved communities. It shouldn't be some random kid coming in from, Minnesota to Reading, right? And connecting with communities. It just doesn't work like that. Like we need to strategize better using cultural competent tools, right? Whether that's people from the area or people who actually know the area, and just really being those allies, right? Working with our allies, coalition building, working with the grassroots groups who are on the ground doing things like Casa San Jose in Central PA, Casa in Action. I'm missing a lot of them because there's a ton of incredible organizations doing a lot of this work with GACLA, right? It's coalition building and really working together to support and serve these underserved communities.
Mm-hmm.
This is so interesting, Kaylin, that you were saying, because I was thinking that we're hosting this discussion at a university, and probably one of the groups that could be really targeted, not just being Latino, but being willing to participate more are our students, undergraduate and graduate students that could potentially be more engaged or could be just more knowledgeable about all that. Because in many cases, I'm teaching a course on history of Brazil this semester, and many of them, they have no idea, and they get so interested when they know a little more about, a little context. That I was thinking, actually, listening to you, to Monica, is that what do you say to some student that comes to Pitt that wants to be engaged, but doesn't know how to start or where to start?
Call me. Go to our website, sign up to be a volunteer. This is something, again, this has been something we've been working on since the inception of Casa San Jose. We are really the leaders here in this area doing civic and social engagement and advocacy, and we are not going to do it by ourselves. So we invite anyone who wants to get involved to please receive our newsletter. My email is on the website. I love talking to people about this because I firmly believe we are going to change people's lives every single day, but we're going to change the future of people's lives by getting more involved on a much larger scale. And this is how we have to do it.
Well, thanks so much, Monica. And I hope that our students are listening, are among the public, and they now know what to do, and just think about not be shy and just show up, which is, I'm sure, a great experience. I'm gonna pass to the next question by Erica Davis. She asks, thanks so much all the panelists for being here and holding this space for engagement with the community. And she says, as an Allentown resident, it is pleasantly surprised to see Latinos from other cities and regions of the state represented here today. My question is in regards to the initiative for fair funding for growing PA school districts, such as Allentown and Reading school districts, which are majority Latino districts. What is being done to address the underfunding of these school districts, and how can we advocate at the state and local level?
This is a wonderful question, Erica, and it's because this is where we can really make a difference with our current elected officials. We all know that Pennsylvania has unfair funding formulas as they relate to school districts. I'm not going to pick on my friends in Montgomery County because they're bad people, but because they have an affluent school district, whereas the one here in Reading is not as affluent, and in fact needs more resources in order to teach their pupils. So there is an unfair balance right now. It's a question that the General Assembly has to decide where it's going to put its resources. A budget is not just a list of numbers, but a sense of priorities as well. Governor Wolf has fought and pushed for equal and fair funding for school districts, especially those in urban areas that continue to grow. Latino students deserve nothing less than the same, getting the same thing at the same place at the same time. We as Latinos have to talk to our local elected officials We have 203 state House members and 50 state senators. That's 253 in total. We need to reach out to them, but we need to be strategic. We should start with the members of the House Education Committee, the Senate Education Committee, and push for an equitable, fair funding formula, which is also a very good exercise in terms of getting involved and talking to people. Everyone should have access to a computer, and you should be able to go online and find who your state senator is or your state representative is and advocate passionately for equal funding, better funding, especially for urban schools.
Thanks so much, Abe. I was thinking that as you were talking about how we should address the Latino population in a way that they are treated and should be always treated as the same as the others, I was thinking about the programs, the language programs in the schools, and how important it is to provide a good Spanish and Portuguese training, really good language training. So and also, again, going to how the non-Latino allies can be involved in that. If we can speak the same language, or at least understand, or at least have some sort of develop some cultural sensitivity, I am sure that this is a very good step. So all those activities that can happen in the school level, they are really, really important, as those kids, they are growing up in the same place. So it's a wonderful opportunity to really make those connections happen beyond their groups of origins or beyond their neighborhoods, etc. I'm going to pass through the third, the next question, which is about the fact that here in PA, many Latinas do not have the right for Medicaid during pregnancy, like in many other states in the US. There is a big inequity that is specific of this state. What has been done in terms of policy to change this?
So I don't know if Mr. Moros, he may have some information about this. I will say what I had said before in terms that Pennsylvania is behind many other states in the country. Illinois, California, New York, Massachusetts, they have healthcare that reaches to many, including all children, and in this case, pregnant women. I am hoping that we learn things from the pandemic. And one of the things that we should have learned from the pandemic is the importance of having prevention and investing in things like health insurance. I am hoping that our legislature in Harrisburg are thinking that maybe investing in health insurance will save us a lot of money in hospitalizations and in morbidity and mortality because of COVID, and in general for any other condition. When you have a mom who is pregnant and doesn't have health insurance, that results in an appropriate prenatal care. And if that mom doesn't have appropriate prenatal care, that's going to result in even morbidity or mortality of both the mom and the child. And that's a cost that we cannot afford as a community, as a society. So my hope is that things change, that we have learned from this pandemic, and that in the future in Pennsylvania, we have health insurance for all, starting by our children, but why not including our pregnant moms? And I will say it's not only Pennsylvania, it's the entire country. And another lesson that we could have learned from the pandemic is that if we leave somebody behind, we're not helping anybody. So for people who think that making these changes in the legislation and giving health insurance to pregnant moms or to kids is only benefit them, they're wrong. This is something that is benefiting the entire community, the entire population. So if we have everybody with health insurance, everybody with healthcare access, we're not leaving anybody behind, and we make everybody in the society, whether you're Latino or not, in a better position. It's worth to invest this money. That's the way that I think. That's how I think what we should promote. And again, I will defer to others, maybe Luz, maybe Abby, to talk about what is happening in Harrisburg.
Does anyone want to follow on that question?
Well, the one thing that I would say is that, again, Abe had nailed it. You know, obviously we want to be able to hold some of our legislators in the House of Representatives accountable. If there is even a piece of legislation that perhaps is not going to benefit our Latino population statewide level, again, you know, these commissions are established specifically to advocate for our communities. And if there is something that is going through the state legislature that perhaps is not going to align with the needs of our Latino population, we need to come together and advocate and create a strategy plan to be able to reach out to our legislators and, make sure that those pieces of legislation doesn't go through even to even hit the floor, as one say when anyone is doing these bills on the House. But nonetheless, again, what I would say to that is that when there is these legislations, we need to make sure that we have our eyes peeled, that we are paying very close attention to what's happening in the state legislature, so that we could continue to partner with our organizations. And I know, again, Monica is we have had this discussion before on other pieces of legislation and making sure they're either going to benefit our population or not. And ones that are really not going to be beneficial are the ones that we really need to nail down. So for the viewers out there, and if there is something that perhaps, you hear through your state legislature in proposing something that is not going to be beneficial, well, you have reliable partners, allies like us in the commission that could be able to advocate specifically for those pieces of legislation that doesn't work. So, but thank you for the question.
Well, thank you. Thank you for the answer. And as we are approaching the ending of our panel, I'm going to address the more questions are coming. So I'm going to read all of them and then allow all of you to answer and also make your final remarks. So Brooke Molina, she comments on the fact that although it seems still low overall, it's very nice to see a consistently increasing trend in the number of undergrads at Pitt who identify as Hispanic or Latino. So it was 2.7% 10 years ago in fall 2011, and now it's 5.8 in the fall 2020. So it's really a big increase. It comes from the dashboard online at Pitt. And she asks, how many of you have noticed that there are cultural stigmas in many of the Latino communities against behavioral health care? I have heard some personal anecdotes about this, but would appreciate perspectives from the community leaders. Clearly, we have structural barriers, but there are also cultural barriers to address. And she's talking about drug and alcohol and mental health. And finally, Sarah Marquardt is thanking you all for the incredible work you have been doing in the Latinx communities here. She is exhausting just thinking about the complexity of some of these challenges. What do you do to stay motivated and keep bringing your best self to your work? And this is just a wonderful question for us to move on to our and give the floor to our panelists to bring their final remarks. Why don't we start in the order? Oh, go ahead.
Yeah, sorry, just because I feel like I haven't answered all three of these while it's fresh in my mind. Number one, I love the statistic that you shared about about Pitt and Latinos in my undergrad class. There was only 2 Latinas there, and in my graduate studies there was only one, me. So that was, disheartening. But I will say that I hope that we are doing what we can to keep those people here once they graduate. So there's that. The second, I forgot what the second question was. I'm so sorry. Oh, about stigmas. Yeah, absolutely. And so we have developed a program at Casa San Jose that helps people connect to resources and services that are culturally appropriate and linguistically appropriate. And we do that by providing intensive case management service to those people, because a lot of times folks are coming from countries where these services are not available or they're not even talked about. So there's that. And I can talk more about that. But the last question how do we not get tired? Well, we do. I get tired. I'm sure everybody else does. But the truth of the matter is, and I said this the other day, it's I'm raising kids in Pittsburgh. And if I want my kids to be successful, it's not about other kids. It is about other kids in this community, but it is also about my children. I want my children to have every single resource and access to anything that they need as my white neighbors, as the people who have been in this city, in this town, in this country for hundreds and hundreds of years. And it's not going to happen if I sit here sitting on my hands and staying quiet. One day we were driving home, and my son, when he was little, would say, "Mom, that's my city of Pittsburgh," because he was born here. And then I said, "Yeah, but it is. And he said to me the other day, "Mom, why don't you run for mayor?" I said, "No, you're going to run for mayor. I'm doing all this work. So I'm opening the doors for kids like you to make a big change when I'm long and gone." So I will leave it there.
Well, thanks so much, Monica. And it just brings so much enthusiasm to, this group is full of enthusiasm to the public as well. Let me pass to Kaylin for your final remarks, and then we'll pass her on.
Sure. Monica for mayor. What's the next one? 2026, maybe? So no, I'm really honored to be here with such incredible leaders, making the Commonwealth really a better place for all our communities, between vaccinations, school districts, healthcare, like literally everything, all parts of our day-to-day lives are impacted. And you guys are really making it a better place for Latinos throughout the Commonwealth. For me, it all really does tie back to voting. The state legislature right now is sitting on a ton of money that could be going to our schools. They could be going to helping vaccination efforts. It could be going to a lot of things that would help our community, but it's not because of who a lot of our elected officials are. And I'm not going to tell you who to vote for. But next year, all of the state legislature is going to be up for re-election, and a lot of the state Senate is going to be up for re-election. So, if you're upset with, Medicare not reaching pregnant Latino women, run for office and try to running for office and putting pressure on who's already there, making these policies will make a difference. You can run for office or call your elected officials if you can't run for office. Put together and have some friends come over and, have cheese and crackers and call your elected officials, write postcards, write letters to your elected officials, telling them that we need school funding in Reading and Allentown. We need better proportionate spending in my community. So it all comes back to civic engagement, whether or not you can vote, whether or not you are a citizen, whether or not your voice is meant to even be heard, right? A lot of the times these systems weren't made for our voices to be heard. And taking that action will really go a long way, and being an ally and helping people, amplifying those voices will really go a long way. So thanks again for having me.
Thanks so much, Kaylin. I'll pass to Luz.
Yes, I just wanted to just circle back on just what are the other questions that one of our viewers had just about the Drug and Alcohol Office, DDAP. Basically, one of our partnerships is exactly just that, making sure that we are partnering with DDAP to push out the resources that they have. And I have in front of me really quickly just a few things that are very top priority for DDAP. And I wanted to share them because, again, we wanted to make sure that we're highlighting these and making sure that our community is aware that the Department of Drug and Alcohol is focusing on resourcing. Again, this is about the civic engagement piece, as we're talking about, and making sure that folks are reaching out to our leaders and to our people that are in these kinds of positions to make sure that our communities are getting this information. But one of the heavy focuses for DDAP is increasing the availability of prescription drugs take-back boxes across for more than 180 locations. Launching the Pennsylvania's Get Help Now hotline and directly connecting with more than 43,000 Pennsylvanians with substance use disorder treatment since 2016. Expanding access on naloxone in the communities around Pennsylvania, implementing warm handoff programs across 95% of Pennsylvania's hospital, helping overdose survivors directly transition into a substance disorder to treatment, and increase access to medication-assisted treatments and treatment for uninsured and underinsured individuals with substance use disorder. So this is just a few of the initiatives that DDAP has been focusing on so that we're better serving of folks that have this disorder. We know that we have seen that, again, as most of you know here, I lived for all my life in Philadelphia, and we have seen a substantial increase of individuals that are, suffering from this disorder. And we want to make sure we're doing everything possible to continue to resource and to help treatment for these individuals. So I hope that did answer the question. But again, this is about the reassurance that I can give as an executive director, that we are working hand in hand with these agencies to make sure that we're doing everything possible to help resource our communities. And again, it goes back to the language access piece, where I feel like we have did the breakthrough, where before you have never seen all-inclusive Spanish press conferences, where now you are seeing that, and where these secretaries are really open to having Spanish translation throughout these press conferences, which is very essential to the work that we're doing. I wanted to kind of just point that out a little bit there. Of work that we're doing here too. It's really important and gratifying.
Well, thanks so much, Luz. This is really important and informative. So I'm going to pass to Abe for your final remarks.
Yes, Brooke, thank you for your comments, especially the one on higher education, 2.7 to 5.8. That constitutes a greater than 100% increase. That's a step in the right direction. We're going to see some paradigm shifts coming up in the next 10, 20 years as well, where students of color are going to increase dramatically because of the way that universities and colleges market to the student population and the growing population and the needs. Disparities in health are always going to be there. In fact, disparities in our society are always going to be present, and it is our responsibility to speak out when you see an injustice, whether it's an environmental injustice, whether you see an educational injustice, something in the business community. It's our responsibility to speak out. And lastly, how do we keep going? I ask myself every day, am I my brother and sister's keeper? The answer comes back yes, every time. I can get frustrated, but I can't quit. It's okay to be human. It's okay to vent. I vent on a daily basis sometimes, but at the end of the day, we still have a responsibility to each other. And I take that very seriously, especially with the Latino community.
Mm-hmm. Thanks so much, Abe. Diego?
Well, I want to end by thanking the people who put together this panel, Gina Garcia, Kayla Greenberg, the staff who are working behind cameras, Alexis, Ron, Matt, Luz. Thank you so much for having me. And thank you to my colleagues who have shared the panel with me. It's an honor to be part of this panel with all of you. Quickly to answer the questions that were posed to us. I'm really happy to hear that the number of Latinos at Pitt are increasing. My dream will be when we see more local kids who attended to our Pittsburgh public schools attending to Pitt. That will be my dream. And actually those numbers that Professor Molina was sharing with us hasn't been for free. There is a lot of work to make sure that those numbers has increased. Belkey Stories, many people at the Center for Latin American Studies, at the Global Studies. So thank you for all the work that you do. And again, it's an ongoing work. It hasn't stopped there. We need to continue doing it, and we need to do it for our local community. In terms of the stigma, yes, there is a stigma in the Latino community about mental health. Many of our Latino families don't even know what autism is. There's a stigma about depression, anxiety, mental health treatment. What we do is we have a local newspaper in Spanish, and I write a column every month. Of course, over the last 19 months, every column has been about COVID. But even with COVID, we have talked about how things like depression, anxiety has increased with the pandemic. And we want to make sure that everybody has access to resources that are available. And by the way, if anybody needs those resources, there is Resolve Crisis, 1-888-7-YOU-CAN. They have interpreters. Anybody can call in Allegheny County and get help in this crisis line. So there are resources, and we need to bring down the stigma about mental health. How can I keep motivated? Similar to what Monica was saying, I'm a father, my son is 7 years old, and I want a better future for my son. But the other thing that keeps me energized is things like this, is seeing my colleagues and the other faculty in different divisions working with me. And also every time that I see, for example, one of those kids that 20 years ago I saw as an infant, and now there is an adult and it's first generation graduating from high school, from college, that also gives me the energy to keep going. And when I see, for example, one of those teenagers or young adults becoming productive and giving to the community, I'm very proud to say that one of our medical assistants now was my former patient in our clinic, and she's helping us to deliver healthcare. So those things keep me motivated. So thank you for what you do. And then lastly, there was a question about involving the Department of Hispanic Languages. Yes, we have done it in the past. The students are welcome to volunteer in our clinics. They're welcome to volunteer in Casa San Jose. I'm speaking for Monica. Because of the pandemic, things have been a little bit slow and put on hold. But yes, we want to partner with everybody, and we have to work to make the work together. So thank you, everybody.
Well, it's my turn to thank you all, the panelists and the public, for being here. It was a great discussion, and it was so good to meet some of you that I have not met in person, meet at least digitally. And I also want to thank the class staff and all the other organizers too that put this together. Among the staff, Alex Stakushan and especially Luz Amanda Hank, who really works a lot on making our engagement with the community a big part of what we do. And this is really an important mission for us. And I think that we are just moving forward to be more connected and to find creative ways to be together. So thank you all, and hoping to see you soon in person. Stay well.
You're all welcome to join us for live music. Thank you. This was amazing.
Thank you, Gina, for putting this initiative together. What a great meeting. Thank you. Thank you so much. And thank you, Kayla. Honored to be part of this panel.
This was very good.
Thank you. I just want to say thank you. This was a great panel. I wish we had more time, right? There's so many other stuff that we can definitely talk about, right? But, you know, really happy to share and be a part of this. It was really, really good, really nice. And, you know, I hope it gives a better perspective on some of the commission work. Oftentimes we always get this question like, oh, well, what is really the commission